What happens after psychological debriefing? What really happens after psychological debriefing? This process is designed to provide emotional support shortly after a traumatic event. Typically, it happens within the first few days and usually involves a single session lasting 1 to 3 hours. Mental health professionals or trained peer supporters often lead these sessions, which can be conducted in groups. The main goals are to help individuals process their trauma, normalize their reactions, provide coping strategies, enhance group cohesion, and identify those who may need further help. However, research indicates that the outcomes of psychological debriefing may not be as beneficial as once thought. Studies show that it does not effectively prevent post-traumatic stress disorder, commonly known as PTSD, or reduce psychological distress. In fact, some research suggests that it may even increase the risk of developing PTSD symptoms or depression compared to not receiving treatment or other control interventions. This could be because debriefing might interfere with the natural recovery processes that often occur after trauma. After a debriefing session, individuals may feel some short-term relief, but this does not usually lead to better long-term mental health outcomes. Because of these findings, current medical authorities do not recommend routine psychological debriefing for all trauma victims. Instead, a more effective approach is to screen individuals after trauma to identify those at higher risk. This allows for targeted, evidence-based treatments, such as brief cognitive behavioral therapy, which is delivered over multiple sessions starting around 2 weeks after the trauma. In summary, after psychological debriefing, there is no consistent evidence showing that it prevents or reduces PTSD symptoms. Some individuals might even experience worsened symptoms. The natural recovery process can be disrupted by this intervention. Psychological debriefing is generally a one-time session shortly after trauma. More effective early interventions focus on screening and tailored therapies like cognitive behavioral therapy. Mental health professionals may refer individuals needing further support for additional assessment and treatment. This understanding aligns with the current scientific consensus that psychological debriefing should not be used routinely as a preventive measure for PTSD. Early intervention strategies should focus on personalized care based on individual risk and symptoms. Always consult with a healthcare professional for personalized advice and support.